Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Calcium oxalate stone. The calcium oxalate stone is the most common type of kidney stone is calcium oxalate stone. So the main risk factors of calcium oxalate stones are, first you will see there is presence of hypercalciuria is seen, or hypercalcemia is seen, or hyperoxaluria are the risk factors. If there is increased calcium in the urine or increased calcium in the blood, increased oxalate in the blood, obviously whenever, because the first step of urine formation is supersaturation. So in order to get supersaturated the urine, in order to have supersaturation of a substance, we need to have excess of that substance in the blood and also in the urine. So hypercalciuria, increased calcium in the urine, increased oxalate in the urine will predispose to calcium oxalate stones. These calcium oxalate stones have hard, small, and they have jagged surface. So on cut section, you will see presence of concentric lamellae are seen in the calcium oxalate stones. Then one important thing in the calcium oxalate crystals are these calcium oxalate crystals in the urine are the most common constituents of human kidney stones. So most commonly, the most common type of stones are calcium oxalate stones, as already said. Now, one important thing about calcium oxalate stones is the ethylene glycol poisoning. Ethylene glycol poisoning is associated with calcium oxalate stones. Why? In ethylene glycol poisoning, if the patient first on inhalation, first when the patient inhales the ethylene glycol, so on inhalation or ingestion of ethylene glycol, either accidentally or voluntarily, that is deliberately, this will result in partial oxidation of the oxalate. So whenever there is partial oxidation of oxalate, when a person accidentally or deliberately ingests the ethylene glycol, there will be partial oxidation of oxalate. Because of this partial oxidation of oxalate, excess oxalate is seen in the urine because it is not metabolized, right? There is excess oxalate in the urine. First it is in the blood, followed by it is filtered into the urine. This excess oxalate in the urine will result in deposition of calcium oxalate crystals, and occasionally these calcium oxalate crystals can also result in renal failure to the patient. So whenever anyone accidentally or deliberately ingests the ethylene glycol, then there occurs partial oxidation of oxalate stones. These oxalate stones are present in the urine. So these oxalate combines with the calcium to form calcium oxalate stones, which can result in renal failure.
thank you and thank you for watching.